Good morning. I'll speak loud and the microphone will make up the difference what little it provides. In Michigan, we've been looking at these issues now for about 12 years. We began the Michigan Catholic Conference in working closely with, in coordination and cooperation with Michigan Right to Life in the late 90s and in the early part of the 2000s. Looking at with how to provide protection for providers, how to provide protection for payers, how to provide protection for institutions. And a lot of this was driven by Illinois passing some comprehensive protection in the late 90s, mid to late 90s, and we thought we should be able to build off of that and make ours even better and even stronger. We struggled through that for a few years. We had some draft legislation that we worked through, and finally in 2005 we had legislation that we were able to move and pass through the Michigan House of Representatives. And it passed through overwhelmingly. It passed on a day when we had about 300 grassroots Catholics sitting in the balcony of the State House of Representatives, and it was a very important day. Those bills then stalled in our state Senate for a variety of reasons, all purely political, because of the walls that were put up by the secular, even by organizations that didn't have a particular position on the legislation. The Medical Society, the Osteopathic Association, the State Hospital Association, who said that they were neutral and didn't have a position, yet raised objection after objection with the members of the Senate Health Policy Committee, and particularly the chairwoman of that committee. And so the legislation wound up dying that session. And since that time, we've not been able to bring, because of the politics, the dynamics here in the state of Michigan for the last 4 years, it didn't make sense to bring anything up, or there were bills introduced, but they were never given an opportunity to be moved forward. We have a new political reality in the state, and it's our hope that working together we'll be able to, and as Mike said, have a new approach and a new look, and look at this in a new way to try to move something and provide those protections that we believe and have believed for many years is necessary.
Well, I'll just try and provide a color commentary for the play-by-play man, which is what Paul and I do a lot in our state legislative process. Just because I know we have a number of states represented, and we really do hope this lights a fire. This conference needs to take you back to your state to light a fire and go to your state legislatures and work on this battle in your own states. So that process that we went through involved bringing forward a bill to protect conscience rights and having in a legislative committee hearing a gay rights group come and say, well, you just want to foster homophobia and people will refuse to treat people with AIDS and HIV because you're afraid of them. And then it turned into, well, you're gonna be finding ways to not treat people of color or people of various persuasions because of your bigotry and your bias. And then, of course, you're going to have pharmacists who are going to stand there and sneer at women and not let them have their birth control at the Rite Aid. I mean, you have to understand that the reason that map that Bill showed earlier has so few states with comprehensive conscience protection is because these debates get highly politicized because these types of issues are brought forward in the testimony, and they can blow up a committee hearing in a heartbeat. And nothing terrifies a legislator quicker than to start talking about people's birth control, because honestly, their brains go, everything shuts down. So it's a real battle. Richard knows what I'm talking about. You start talking about birth control,
some of those brains don't have a long way to go.
So I just want to present those kinds of realities. So some of the strategies we've undertaken in Michigan, and you may have to consider, as Bill also said, you take what you can get. You start with this model bill that has everything in the kitchen sink. And then as various objections come forward, and Tim Van Dolen and I were just talking on the break about the civil remedies can cause you a problem. Or you may have a lot of success with a broad conscience provider or provider conscious thing, but you're going to run into difficulty as you start talking about the institutions, the hospitals, the Catholic health systems, or Lutheran nursing homes, etc. And you may have another battle on your hands that's different when you start talking about the payer system and what will be required under law to be included because you have states that mandate contraceptive coverage in all their health plans. I think it's 17 states or more. So these are separate fires that can crop up and may cause you to adjust your strategies and take what you can get in that territory. Start with the whole ball of wax. But those are some of the kinds of dynamics, and as we can sit and talk in the workshop later, or as you maybe go back to your state and start connecting with your Catholic conference there, your local Right to Life manifestation there in your state, and other organizations, types that Chuck Donovan might be involved in and others, you have to start looking strategically in these ways. So it's a complicated reality. It's a difficult political environment, but as all the speakers have said, it's critically important that we engage the battle now, because things can only get worse if we just throw up our hands and do nothing.
Well, as long as Richard Doerflinger is beating up on legislators, I have some history with the conscience issues back in the 1970s. I was the legislative director for National Right to Life Committee, and one of the things you learn lobbying on Capitol Hill on a daily basis is that you need to be up there on a daily basis if you're going to make an impact. There are so many misdirected, you talked about some of them, the issues that come up that are really not very valid issues, but it can emotionally blow up a situation. Well, I was involved in the part of the church amendment that dealt with medical school applications. It was somewhat circumstantial. I had 3 siblings back in the 70s who were going through medical school, and one of them faced the question in his interview. Actually, I think it was my sister. And you don't ask my sister that question without expecting a pretty clear answer. And she gave a very blunt answer, but felt the negativity in the room. Now, it didn't lead to anything negative for her, but there were other reports in the 70s that students were facing this question. A couple of universities had kind of made clear, I think Wright State was one of them, in fact, in Ohio, that your chances of getting in if you pronounce pro-life views were not very good. Well, we had trouble getting this amendment to the church amendment considered. We had a senator who was in favor of it, Richard Schweiker. In fact, he was the sponsor in the Senate. And here's how it got into the House bill. It's not very pretty. Congressman Bud Schuster was a chairman of the corresponding committee in the House. And another lobbyist and I, a fellow named Doug Badger, who's a health care guru of sorts still in Washington, and I were in Senator Schweiker's office talking to his chief of staff, and we said, look, we've got a little problem with Schuster. He's not sure he wants to mess around with this amendment. And Schweiker said, well, he's from Pennsylvania. And he said to his chief of staff, Dan Burke, give him a call. And this is the way the conversation went. It was very short. Burke called over to Schuster's office and said, we very much want to support the $232 million you have for that hospital in your district. If you want the senator's support, put this language in the bill. And there was a silence of about 3 seconds on the other end of the line. And at the end of the day, the earmark was traded for the amendment. So you had to have at least a fairly pro-life set of legislators in both cases to do this. But sausage making, legislating, and lobbying have a lot in common. Don't want to disillusion anyone, but you really, the lobbying campaigns being made, if you're going to do one in your state, do all the traditional things, grassroots, professionals, get prepared for the outlier arguments as best you can, because they will come to politicize this, but expect to be there. I mean, Wisconsin is happening. What's happening there is a drama of 24/7. Don't expect that, I hope. But do expect that there'll be a lot of unusual things that will happen before you get the legislation done.
I just want to follow up on that in terms of coalition building, and there are some strange bedfellows. Paul and I were talking at the break, and actually I think he has, in terms of my charts, a perfect record, because he corrected me on the contraceptive mandate, that he was able to defeat that. But he was talking about his good work with the unions, and I know when I was trying to defeat assisted suicide in Connecticut, it was actually when the unions, when I was able to convince them that it would be cheaper to pay for the prescription, the lethal prescription, than it would be for the good care that they provided in long-term care. All of a sudden, I found the healthcare unions that would be with us on that respect for the life and dignity of the elderly. So that coalition building is just so very, very important. And I know a number of the issues that we focused on today seem to be at the beginning of life, although we did talk about assisted suicide, but there's so much in terms of end-of-life care that our elderly are so in jeopardy, so in jeopardy. And of course, it's all about rationing. It's another way to subtly impose in terms of reimbursement and government policies in terms of care of the most vulnerable at the end of life. So those strange bedfellows working in coalition with those who might, as we've talked about, there might be people doing the right thing for the wrong reason, or it might be the right reason, but finding those partners. And finding a way to iron out the things that we disagree upon behind the scenes, that they don't get aired in public. We iron out as much of that ahead of time, and having a united front that is so important.
Is it working? Okay.
Oh, I'm sorry.
I want to, sorry?
No, go ahead.
Oh.
I'm sorry.
I want to add a couple things. Like Bill, I'm willing to send my PowerPoint if you find it useful to anybody who gives me their email address. But also, I think in considering the laws, there are a number of decisions to make, and one of them is about the scope of what you're trying to cover. Some of the laws that are at the federal level, of course, only cover abortion. And when you're talking about abortion, you're talking about the taking of life, and it's something that the vast majority of doctors now do not do. And it's something that is clearly forbidden by all traditional medical ethics in terms of Hippocratic oath. You can make some very broad statements about no one, for any reason, being required in any way to participate in it that you might not be able to say about other things. And so, you know, in terms of broad conscience protection that talks about many things at once, I would recommend just taking a quick look at what your state already provides on conscience protection on abortion, and whether that's clear and is as good as it needs to be. And in at least 46 states, you have some conscience protection on abortion. Some laws are better and clearer than others. And then you can talk about broader conscience protection in addition to that, you might be able to have some restrictions to cases where someone can cite in writing a moral or religious conviction on this. You don't need a moral or religious conviction to refuse to participate in abortion. You just need to be a human being who understands what it is. So it's something where sometimes you figure out where to start and then go from there. But most states, as well as these federal laws, have some protections regarding abortion itself. There's also decisions to make about protecting the consciences of individuals and institutions. Sometimes those can seem to come into conflict. And one of the hesitations we've had about beefing up the enforcement, for example, of the Church Amendment, is that if you just give a private right of action for everything that's protected under that bill, that means you are potentially putting a new tool into the hands of the local pro-abortion doctor to sue the Catholic hospital because he missed out on a promotion, saying, well, it was because I do abortions elsewhere, now I'm going to sue you in court. So you have, some laws concentrate on institutions, some on individuals, and some talk about both, but then you have to look at, making sure one is not unjustly overriding the other. And finally, I think that, the Obama regulation, the Obama regulation on conscience, it basically stripped everything out of the regulation except for the fact that anybody who thinks they're being discriminated against under any of these federal laws can go to the HHS Office for Civil Rights. And everything else is what they call dicta, is commentary. I don't read the regulation as stripping away anything the statute says about certain circumstances where you're protected under any procedure. It can't, in fact, reverse a statute. But certainly the commentary in the reg was emphasizing abortion and occasionally sterilization, and not mentioning that there are parts of the Church Amendment that actually potentially protect you and everything else. I don't want anybody to think that's been simply taken away, though maybe they'll be less aggressive on those. And in that regard, I think the biggest problem of all is that even where the laws apply, very few health professionals know that they have rights. I think, I was I said something at a meeting I thought was sort of a casual remark, and everybody said, wow, that's a great idea. I said, why doesn't every doctor or nurse who's associated with Catholic hospitals or Catholic Medical Association, so on, have a little card that reviews what the laws are, and on the other side says where you go. You know, what the email address is of the HHS Office for Civil Rights. Maybe even the names and phone numbers of some of the legal defense firms that take on these cases on behalf of health professionals like Nurse DiCarlo. And there was such enthusiasm, I now want to work with a couple of medical groups, see if we can produce such a wallet card. Just so everybody knows, here's where you can go, here's what your rights are. A lot of the hospitals don't know that they're covered by these laws. A lot of the individuals don't know that they are protected by them. The Obama administration said in the commentary on their reg, they are going to be putting a clause into grant applications for institutions getting federal funds that reminds them they are covered by these laws, and they are going to be doing outreach to medical professionals to explain their rights. That was something that used to be in the reg itself under the Bush regulation. They took it out of the reg and say they'll do it by more informal means. Because putting it in the reg and requiring this of everybody in terms of advanced certification would violate the Paperwork Reduction Act. This is a couple of weeks before they put out yesterday a new 419 pages of healthcare reform regulations. So take that with a grain of salt, but we'll have to hold their feet to the fire to see if they really do that outreach. But if they don't do it, we must.